Hello, I'm Amanda Reagan. I'm State Senator from Mason City, and I chair the Human Resources Committee, and I have since 2006. Governor Branstad is really right to focus on wellness and prevention. As he points out, helping people stay healthy is the best and most cost-effective way that we can provide health care. The most important benefit in having health insurance is having an ongoing relationship with your provider. That is the core of the new health care opportunities that Iowa has right now. And we can move even further away from fee-for-service. We can move even more in the direction of paying for health care providers to keep people healthy, and rather than to just responding when people are ill or sick. That's why the governor's plan and staff put together the governor's ideas. We accepted some of those, and we had the first meeting of the Senate File 71. We adopted many of those things, and we took the governor's innovation grant language and made it part of our bill. We believe in the integrated care system, and we agree with him moving to outcome-based Medicaid care is the way to go.
Good morning. I'm Pam Yokum. And yesterday, Senator Hatch, Reagan, myself, and Senator Yokum met with the governor's staff, and we offered a compromise to address his biggest concern with Medicaid expansion, and that is the long-term reliability of federal funding. Following the lead of other Republican governors in other states, we have offered to reevaluate Iowa's participation in Medicaid expansion if the federal government does not keep its promise. In other words, if it would renege on its commitment of paying 100% of the cost for the next 3 years, and then of course it's on a sliding scale, that by 2020 it's 90% participation by the federal government and 10% participation by the state government. The language we suggested would protect Iowa's taxpayers from any risk, and it would address the governor's concerns. In short, if the federal government's sky falls, we'll be off the hook as a state. I want to mention, and we should all remember, that the federal government has never failed to meet its obligations to Medicaid in nearly its 50 years of existence. We believe that this is a step forward in trying to reach some kind of compromise with the governor on making sure that all Iowans have affordable health care and access to health care.
Good morning. I'm Jack Hatch, and I've been working with Senators Yokum, Reagan, and Yokum on working through our process of trying to get a proposal that is best for Iowa. Recently, been working with the governor's staff, and I think you have a comparison in front of you of our two plans, the Senate proposal and his proposal. It seems like we're agreeing with the governor a lot. I'm here to tell you that there's a significant part of his proposal that we cannot agree with, and that's first his funding, and that's what we want to talk about today. His structure of financing his proposal is a huge obligation of state dollars of $163 million a year. He is asking that we remain under the old 60-40 plan and that the state taxpayers incorporate and invest $163 million to fund Medicaid expansion that doesn't do as well, provides fewer services to fewer people, and costs us $163 million a year. It's important to know that this is a hit on Iowa taxpayers. It's a hit that we don't have to take because the Senate plan fully accepts the federal investment in Medicaid expansion. And if you look at the bottom of your sheet we gave you, there's a very significant irony in his plan. He asked for $224 million in federal dollars to match the $163 million that he's proposing. The difference is that under Medicaid expansion, through the budget reconciliation plan of 2010, the federal government's contribution to states is already obligated and is already part of the deficit reduction figures that we're hearing about in Washington. Under the governor's plan, he's actually asking the federal government to appropriate new money, $224 million. That is not covered under the reconciliation plan. So he's actually adding to the federal debt in the very program and the very criticism that he says he wants to avoid. It's a strange phenomenon, one in which we realize that his people have to work a little harder in understanding the law. Now, there's another part of this plan that he's cobbled together, state and local money, that is also disturbing to a lot of us and should be disturbing to Republicans who have worked so hard on mental health. Mental health redesign in the past 3 years has focused not only on a regional basis, but how the state and the local counties fund mental health services. In his plan, you will notice that he's asking for $44 million in mental health property taxes to fund part of the state share, which means that he has to go out to each of the 99 counties, get an agreement with all the supervisors to literally scoop that money back to pay for the Medicaid services under his plan, which would lower the available local money for counties to fund other mental health services that we have been working so hard to protect. His plan doesn't make sense at all on the local level, at the state level. And purposely, it is a plan that will take Iowa taxpayers' money away from the state and possibly away from taxpayers who know why they're giving taxes to the state and expect us to spend it reasonably. In the end, his proposal is unaffordable, unsustainable, and unworkable.